Hello, my name is David Matute, and I will to talk about the pharmacology and the treatment of complicated skin and skin structure infection. Well, with definition, we have a pharmacology, that is, studies how to the drug interact with the body, its action and beneficial or toxic properties. The skin is the bigger organ of the body. The skin and its derivatives like hair, nails, and sebaceous and sweat glands made up the integumentary system. Among the main function of the skin is protection. This protects the body from external factors such as bacteria, chemicals, and temperature. The skin structure is made up of three main layers: epidermis, dermis, and subcutaneous or subcutaneous tissues, each of which is made up of several sublayers. The skin infection, sometimes this can cause an skin infection. This often happens when there is a red, cut, or wound in the skin. It can also happen when your immune system is weakened due to another illness or medical treatment.
Our skin, a miracle of nature. Our skin is the most important protection against environmental influences. It consists of three layers: epidermis, dermis, and hypodermis. Corneal cells develop continuously through several stages in the epidermis. They form the outer layer of the skin. Within 1 month, the epidermis is completely renewed through the constant movement of cells to the surface. Lipid substances surround the corneal cells, filling the interstitial spaces between the cells and ensuring a stable structure, which is one of the most important requirements for the protective functions of the skin. Over the corneal layer lies a thin protective film. It contains fat from the sebaceous glands and water and salts transported to the surface by the sweat glands. This protective film has a pH value of approximately 5.5, chemically semi-acid. This is why this hydrolipid film was called earlier the acid protective layer. It forms a further barrier to microorganisms and environmental influences. The skin reacts very sensitively to excessive moisture, water, or aggressive cleaning substances. The hydrolipid film is destroyed. The corneal cells swell up and the lipids in the corneal layer are washed out. The skin becomes dry and lets foreign substances through. Our immune system reacts to these foreign substances with reddening and flaking of the skin or blisters on the skin. Eczema is the result if nothing is done. The skin will continue to inflame and even crack. The regular use of skin protection and skin care products supports the protective functions of the epidermis.
Well, now with the application in medicine, uh, the use of two antibiotics, dalbavancin and oritabavancin, for the management of infection of the skin and skin structure have recently been studied. Although neither of the antibiotics is new, they could have a great impact. Its application in medicine are to combat gram-positive bacteria. They also have an effect against methicillin-resistant Staphylococcus aureus and coagulase negative Staphylococcus, Streptococcus, and Enterococcus, improving activity against some strains that are not susceptible to vancomycin, and reducing the frequency of resistant mutants. Efficiency in response to injury, cellulite or major abscess, no progression, and reduction in lesion size compared with a baseline in a patient who who is alive and didn't receive rescue therapy, determined in 48 to 72 hours after the initiation of therapy. These agents make it possible to treat patients with complicated skin and skin structure infection, who might otherwise require hospitalization on an outpatient basis without compromising efficacy and without the need for laboratory monitoring or an indwelling intravenous catheter.
We want to actually also take a look at the signs and symptoms of a skin infection. So again, for folks to know what's going on, we have that list there. Dr. Vladi, maybe again, you can kind of just remind us what the symptoms might be, that it's time to get some help and go see a doctor.
Of course. So one of the most common signs of irritation and inflammation of the skin is change of color. It turns red, it swells up, it can cause a lot of pain. You can see the breaking of the skin, discharge, oozing, fluid coming out, boils, rash. It can get pruritic, which means itchy. And advanced infections, when they progress, can cause fever, chills, overall fatigue, and of course need to be addressed at that point.
Okay, so again, we've identified kind of what might be looking wrong, and then once we know we need some kind of treatment, Dr. Diegues, what is the protocol when it comes to treating these skin infections?
Well, the most important thing is for us to, when we get concerned, when we see a skin wound, a scrape, a cut, scrape, or wound in our skin, to seek medical attention. A healthcare professional should be able to tell us if this skin wound requires treatment, okay? And within the treatment, we have bacterial, viral, or or fungal infections, and the healthcare professional will determine which type of infection it is, and most importantly, what agent will need to be used to clear the infection from the skin.
Impetigo is one of the most common skin infections in children and infants. It often occurs after injury to the skin or subsequent to existing skin conditions. Furuncles or boils are firm, tender nodules in the dermis or subcutaneous tissue near hair follicles. Carbuncles are deep extensions of two or more furuncles. Carbuncles tend to recur despite treatment and often warrant surgical excision to reduce the chance of recurrence. Cellulitis is an acute infection of the dermis and subcutaneous tissues. Cellulitis can be severe, and it often warrants hospitalization and the use of systemic antibiotics prescribed by a physician. Necrotizing fasciitis is a rare, life-threatening bacterial infection characterized by rapidly spreading inflammation and necrosis of the skin, subcutaneous tissue, and superficial fascia. The varicella zoster virus is a human herpes virus that is responsible for both chickenpox and shingles. Tinea pedis, or athlete's foot, involves the interdigital spaces and plantar surface of the feet. Candidiasis is a fungal infection that can occur as a result of excessive moisture and heat after antibiotic use or when someone is immunocompromised. Candida infections commonly occur in moist occluded skin, such as the axillate, groin, breast folds, and abdominal folds.
Well, with a pro and cons, we have with pro terminal half-life for both are approximately 2 weeks and serum free drops concentration except LMICs for a week or more. They have concentration dependent killing. The treatment were designed to take advantage of these properties by means of the administration of one or two large pulse dose, instant, or of a smaller, closely spaced and multiplied dose. Either agent is certainly easier to administrate, reducing in some cases eliminating costs and risks of hospitalization. Vancomycin light safety profile. With COMS, we have minimum inhibitory concentration are higher than for susceptible strain. Dalbavancin is inactive against a Vance strain of vancomycin resistant Staphylococcus aureus and vancomycin resistant Enterococcus. Neither antibiotic is more efficient than vancomycin. The efficacy of these antibiotics for infection other than complicated acute bacterial skin and skin structure infection is unknown. These drugs take weeks to clear and moderate or severe toxic or allergy reaction, if they occur, could cause substantial morbidity or prove fatal. Well, with applicant in Ecuador, the Universidad de Cuenca said the antimicrobial resistance that the bacteria is occurring is today a serious problem due to the indiscriminate use of antibiotics and hospital infections. For this reason, new antibiotics are tested every day to combat MRSA, among which are dalbavancin. The Universidad Central de Ecuador say that in complicated of cellulitis, its initial treatment is surgical drainage, antibiotic therapy based of clindamycin or vancomycin, plus therapy that includes elevation of the affected limbs, analgesics, and tetanus vaccine if it were due to human or animal bite. Well, with the conclusion, as a conclusion, I think that the indiscriminate of use the antibiotics is a very important issue to deal with, that you have to be very careful, and antibiotics are not vitamins and are given for any fluor injury that exists. And poor antibiotics prescription may cure an infection slightly, but it will cause greater resistance and be worse in the long run. The initiation of adequate pertinence and timely antibiotic monotherapy have demonstrated its efficacy in the treatment of skin and soft tissues infection in the majority of the child population. That the antibiotics used are first line, taking into account the sensitivity of the most frequent germs that cause skin and soft tissues infection. Thanks.